Hello everyone, this is Carl. I'm making this video to talk to you about what am I expecting out of you for your charting on your DocuCare with your vSIM patients. My expectations are that the first few weeks here with me as your clinical instructor are that we're learning how to chart, because I'm trying to teach you how to chart. So if I am doing a chart audit, like I am doing with your DocuCare, I expect to find things in certain places. Just like if you're working at a facility and they're doing a chart audit, they're looking how you charted on your patients, and they should be in certain locations. Your charting should be. Also, if for some reason there's litigation or some type of investigation, they're going to be looking in certain areas for your documentations. So that's what I'm trying to teach you, and for you guys to start learning of how to properly chart. I know in the past some instructors have said, just put it in a nursing note. Well, if I'm looking between shifts at certain things on a patient, I'm looking for respiratory assessment, like on Vincent Brody, as you see here. I want to be able to look at all shifts that's taking care of this patient at his respiratory status. If your shift, you're putting it in a nurse's note, it's not showing up in the assessments that I'm looking at for changes over his stay. And some chart auditors will not go look at the nurse's note. They're going to look at it as, you didn't take care of this patient, because there's no assessment. So with that being said, let's start looking at the charting for DocuCare. Okay, when you first open up your Vincent Brody, this is the screen that we come to. Now, don't pay attention to what's up here, as you guys don't have these tabs on mine. You do have the review, so that way you can look at what the grading rubric looks like. And I suggest you opening that up and printing out the rubric so you have that with you while you're documenting. Because I'm going off that rubric just like I would if I was doing a chart audit. So therefore, you're making sure you're getting everything charted. Now, as you can see, some of the stuff is starting to cross over from your vSIM. It's got his MRN, it has the different information here, his diagnoses. But if you look in this area, no allergies are charted. So I know on a lot of my charts, when I audited them, I said, hey, you didn't ask for allergies, because it's not charted. So if it's not charted, it's not done. So let's see what Carl is expecting from me. So on this line here, you should be going through all of these different tabs and hitting on all these in order to make the benchmarks for your nursing charting rubric. So let's start with patient info here. As you can see, demographics is the first one. Now, like I said, some of this has been loaded over, which been fine. There's nothing to add to this, but hit save. The reason why I say to hit save is it shows me that you did address this category. Okay, because it'll be saved under your charting. Now, if there's things that you do need to fill in, by all means, go ahead and fill this in. Now we're going to go to current visit. Okay, is there things that we can add here? Yes, there is. So I know it has a primary admitting diagnosis, but if you look here, add a secondary diagnosis. We could do that in this case, because what other diagnoses would he have? So you can go ahead and add this through your Lippincott Nursing Advisor. So you could add, let's say, shortness of breath, tension pneumothorax, because he did have a tension pneumo, so we are admitting him with this tension pneumo. So any other additional diagnoses that you can add to it shows that you are understanding your patient's disease processes and also why they're being admitted to the unit. Okay? So after you've added your additional diagnoses, by all means, please hit save. Now, previous visits. We already know he had 2 previous visits for his COPD. It was part of the VSIM. Those are automatically brought forward. I don't see you having to change anything there. Current care providers. I don't see anything having to change there. Admission assessment. So this is the assessment that he was brought in on. But now let's put a quick history of the chief present concern that you walked into. What are you seeing? What report were you giving? Not a full assessment, but what did you get from the SBAR handoff report? So you can put that in here, and then again, make sure you hit save. Now, when I hit this mission assessment, it came up with all of these other ones. So hit these spots as well. Now, provider review systems, that's not us. That will be the physician. Family health history. Can you get any history from him? Did we get anything in that pre-report? Past medical history. Did we get anything off that pre-history? Now, for the surgical histories and stuff like that, you could put just a note here that says, deferred due to patient condition. That shows me that you looked at this, you'd like to ask it, but right now is just not the right time. So I'm going to defer this due to patient condition. So you can type that in there. Transfusion history, we don't know. So could we click unknown? Yes. Pain history? Unknown, because I can't ask right now. The screenings, again, all these could be unknowns. And you could put in the note, unknown due to patient condition. Hit save. So you're showing me that you've looked at these, but since the patient was so short of breath, you're deferring it because he's only doing one-word sentences. That's fine. But it's showing me as a chart auditor or someone that is doing an investigation that you attempted to do these assessments. Okay? Social history. Well, I believe he came in with his spouse, right? So we could say he's got a spouse. And I believe it said he came from the doctor's office, but did it say anything about his home situation? Did he come from a home? I did have a student actually accidentally hit nursing home, but they did the assessment and they showed the assessment. Okay? Again, you can go through these things. It came forward. He's a smoker. Okay? Desire to quit. What is his desire? Okay? And again, tobacco cessation counseling given. Yes, we're going to give it to him. Okay? Can we go through these? Oh, alcohol status. We don't know because we don't have time to ask him. We don't know about illicit drug use. Things like this. But we're saying we would have assessed this if the patient condition allowed. So make sure you go through all these. And you can do the unknown, that's fine. In the notes, put in there, deferred due to patient condition. Or if we're on a different patient where you can do it, make sure you fill these out as best as you can. Okay? All right. So that was our mission assessment. Now on to allergies. This is what everybody was asking me about. Since there's nothing charted here that I see, I know I need to chart allergies. And this is the place. You see the NKA here, but if you look, there's no category or anything, hence why this is sitting empty. So go on there. Add new allergy information. What category is it? Medication. Now let's put in there what it is. Morphine. What's my reaction? Anaphylaxis or whatever one. Okay? Or under medication, if there is no allergy, hit the NKA. When I hit record, now look, it came up as no allergy. So this is how I'm asking you. It isn't charted, so you didn't ask. As you can see, now it is charted. And if you look here, it tells me medication. I documented it. Okay? Now to immunizations. Okay. We didn't ask about any because we didn't have time for this, because it was deferred. So can we go through and hit any of these? We don't know because we didn't have time to do it because of his condition. I understand that. Okay? Now, we're done with the patient info tab. Let's move to the assessment tab. As you can see, I'm just moving across this bar, and when I get a new drop-down bar, I will go through all of these bars. When I put on some of your comments of, why did you chart this? Go ahead and hit all these. I know he had an IV, but you didn't chart that you assessed the vascular access. So this is what I mean. Hit all of these areas. Okay? So, HEENT. Can we quick look at the patient? Do we have to really do an assessment? Can we just quick look? What's his head look like? Is it symmetric? Is there recent trauma? No, he didn't fall over or anything, get hit by a bus. What does his hair look like? Ears. Is he answering my questions appropriately? So I'm guessing his hearing is intact, correct? Eyes. Is he following me with his eyes? You know, is he able to follow me if I walk across the room or something like that? Yes, you're not assessing all of this, but you kind of are without having to physically look and do and only do a head assessment. Just by him answering your questions, his hearing's intact, right? The nose, look at the nose. You know, was there any problems? Mouth and throat. Do we hear anything? Do we see anything just from even across the room? Right? And you can always make that additional note here. You know, again, deferred due, oh, I can't spell. You know, you deferred it due to patient condition. Okay? Save it. Now I know you would have done this assessment if time permitted, but you did do part of it by doing the symmetrical. There is no recent trauma, things like that. It's just a quick look assessment. Now, if it was a patient that had the head trauma or facial trauma, it would be more extensive in here. But because of the patient condition, I wasn't able to do the full assessment. That is fine. Okay? So don't forget, save your assessment. Okay? On to neuro. Well, was he answering your questions? There's his orientation. He answered my questions for me. Okay? Strength. Did he walk in? Was he moving all of his extremities and things like that? Behavioral? Was he calm and cooperative? Was he combative? You probably didn't get a chance to look at his pupils. I understand that. But in a scenario where you do, please chart. Don't forget your GCS. Eye-opening, motor response, verbal response, things like that. You can fill in some of this stuff without having to do the full assessment. And you, again, in the notes, put rest of assessment deferred due to patient condition. That's fine. You covered what you could, but you need to move on because of the patient condition. Cardio. In this Vincent Brody, you guys put on a ECG monitor. Well, down here, cardiac monitor. Check that. Skin color, description. Cap refill, I'm sure you guys assessed. Did you check pulses? Did you check for edema? Again, in the notes. Rest of assessment deferred due to critical patient or patient condition. That's fine. I understand that. But you show me that you've done some of the assessments. And say later on when you do an assessment and any of these change it, come back and do another assessment on cardiac. I know, like with Vincent, later on he complained of chest pain. Well, what's in our chest? A heart? Lungs? So we should have went back and done another cardiac assessment. So I should have probably seen 2 cardiac assessments on this patient. Now let's go to respiratory. So this was a respiratory case. So I should see multiple respiratory assessments. An assessment when I took over the patient, did my assessment. I gave a neb treatment. Well, now I should have another assessment. He complained of chest pain. Now I should have another assessment. We found that pneumothorax. So now we put in the chest tube. Now I should have another respiratory assessment. So you see how I should have multiple respiratory assessments on this patient? And some of you are asking, well, why? Well, there's my reason. And again, fill in what you can on each one. I know it's hard off the VSIM. But like this one, he's having difficulty breathing at rest. That should have been in one of my respiratory assessments that I saw. Okay? And now after the chest tube, is he still having this difficulty? Okay? So I could click none. Now he's not having the difficulties. All my breath sounds that I heard when I was auscultating each time, when I first got him, after a treatment, when he complained of chest pain, after the chest tube insertion. Okay? Respiratory therapies. So I know some said that they put it in for some reason it didn't show up. I will look further into that and look for the ABGs. Also, aerosol treatment. You gave a nebulized treatment, so that should be documented. Did we try any airway clearance? How was our lung expansion? Did we use incentive spirometry on the patient? Okay. Patient education. Look at that. COPD, patient education. So you see how I'm going through all of these blue tabs. That's what we should be doing. And of course, after you do all that, don't forget to save. GI. Well, I know on this patient, you probably didn't have time to do a GI assessment. Fine. Deferred due to patient condition. I understand. Okay? Save it. GU. I probably didn't ask him about all this urine stuff because I need to focus on respiratory. Write a note, deferred. Okay? And so on and so forth. I'm going through mental health. You can quick do something, right? How is his behavior? How about a stressor? Would his condition he's going through right now be a stressor? How do you think his coping is? Okay? Now again, all these blue things that I should hit on. And of course, save your assessment. Pain score. Should I be asking about a pain score at the beginning of treating my patient? And then also, after I've given pain meds, after I've done some type of intervention, splinting, ice or warm therapy, things like that, we should always have multiple pain scales. So with this gentleman, he started playing chest pain. What was it? We found the tension pneumo. We gave morphine. How's his pain? We put in the chest tube. How is his pain? So should have multiple pain scales done. Skin. We can chart on skin. Vascular access. As we can see, there is an IV already in the right hand. But if we look here, reassess. This is where you're going to do your reassessment. You'll click on it, and now you can do your assessments. Okay? Because I'm guessing you looked at the site before you gave the morphine. So you probably saw the dressing. Granted, you probably can't see it in the VSIM, but what are you looking for? Okay? Again, hit save. Okay, so I'm done with all my assessments. Let's move on to ADLs. Chart a new ADL assessment. Chart a new Morse fall risk. Not many charted the fall risk, but essentially you're doing a fall risk on him, because if we're going to fall risk, look at the things that we're questioning. Does he have a history? We don't know. But can we put no? Does he have a secondary medical diagnosis? Yes, he does. Okay? Ambulatory aids used. Well, right now we're going to be probably keeping him on bed rest because he gets too short of breath. And maybe since he's fatigued and with the chest tube, nurse assist. Does he have an IV? Yes, he does. How is the patient's gait? Well, he's fatigued, right? So I'd say weak. What's his mental status? Okay, he knows what his ability is, right? So we'll click on that. And look at, I have a moderate risk on this patient. He's a 45. So we should do a fall risk on all of our patients. You don't have to sit there and ask questions. You can do it by, as the VSIM's going, you can see what's going on, what's happening. I can answer these questions with the VSIM. Don't forget to hit save. ADL assessment. Same thing. What do we need to help him with? How's his diet? How's he speaking to me? That's an easy assessment. Is he A&O times 4? What's his mood and behavior? So there again, we just did that ADL assessment. I say right now, you defer from your notes. Wait until you get done with everything, but keep a sheet next to you and write things on it of, I probably need to cover this, but let's see if there's other places that I can cover it at. Nursing diagnoses. So, of course, we're going to create a care plan. So the nursing diagnoses, think of as many as you can for your patients. Don't just do one, because there's more than one that needs to be covered. So put in here as many as you can, please. So that way I can see your critical thinking. See what you think needs to be done for this patient. Okay? So do as many as you can. Patient teaching. Again, put in as many educational opportunities as you can in here. So for Vincent, maybe he needs more teaching on his COPD. Maybe he needs teaching on the medications that we are giving him. Maybe he needs teaching on the chest tube. He needs teaching on incentive spirometry. He needs teaching on different things. Put as many as you can think about. Don't just put one. As many as you think Vincent will need during his stay. Now, it doesn't mean that you're the one that's going to teach him. It means things that you have thought of that he is going to need teaching on. Okay? Orders. We need to make sure that all orders are in here. Okay? With him, the chest tube insertion was. The morphine was present in here. So I might have been wrong on some of the grading on it. Some of them showed it and some did not. That's why I was a little confused. If there's one on here that you did, if there's one that you did that is not on here, please add new orders, okay, and put it in there. All right? The MAR was another thing that many had asked about. D5 half normal saline with 28K. You said it was already running. Yes, it was already running from the time before you. But I know as a good nurse, you're going to check to make sure that it is infusing correctly at 100 milliliters per hour. And how am I going to say I checked that? Hit the administer button. I have confirmed my rights. Patient secondary check. Medical record number. And administered. Right. That way it shows up for me that you looked at it and you administered this. You checked on it. Okay? So I know there's some confusion on those. The morphine, again, administer it. Don't forget to administer it. I's and O's. Some of the students did put I's and O's in. So how long did it take you to do Vincent? So that continuous infusion of D5 half, that was some intake, correct? So we should record an intake. Did he urinate for you? Anything like that? Did he vomit? Record an output. Vital signs. This was another one that a lot of people questioned. And I know some students said, well, I'm not going to take him off the nasal cannula to get a baseline room air sat. Okay. All right, that's fair. So now we should have some different vital signs, though, correct? He's 94% on his nasal cannula. The reason why I was thinking a different way, because in the emergency department, I want to have a room air saturation, see what the baseline is. I understand what you guys are saying, and I agree with you. It's just my practice is a little different, but I agree with what you guys are coming from. But then I hear that the patient had a pneumothorax and was having problems breathing. Did his saturations decrease with that pneumothorax? But I didn't see any vital signs to support that. We gave him a nebulizing treatment. Did his SATs increase with that nasal cannula after the neb treatment? Some students, I did not see any reevaluation of the SATs. So it doesn't mean you have to do all of these vital signs, but you could have at least done the SpO2 and oxygen delivery again. So again, you're doing interventions. You should have vital for before the intervention, after the intervention. Now comes the pneumo. Before the pneumo vitals, after chest tube vitals. So I should see that. Okay? Diagnostics, I know we had some trouble here because I was asking, well, where's your ABG? Again, for some reason, I didn't see it under the respiratory section for some of y'all. And I don't see it on here. I guess you could hit the other and put it in. And in the notes, put in what the results were. That way it would put me towards this area. Other diagnostics, of course, your x-rays, CTs, and stuff like that, you guys won't put that stuff in. OT. Well, we're not OT, correct. But can we at least fill in a chief complaint or history of current condition? Any pain? What's his activity level? Is he fatigued with activity? We know what occupation he does. I believe he was retired. Objective. Again, another one that's down. Fill in as much as you can. My assessments. What's my plan for therapy? What can I do to help with his therapy? PT, same thing. These can be filled in. Even though we're not the occupational therapist or physical therapist, we can still fill these in. And again, more drop-down blue tabs. Forms. This one only has the incident near miss report. So, of course, you're not going to do anything in this, and I understand that. The different flow sheets. There's nothing to chart, but it might be a good thing to look at to see our vitals that are charted and things of that nature. So now I've hit all of the tabs. Now, what do I think I have left to chart that I couldn't find in the tabs? So, that's when we'll go back to the nurse's note and make my note. Examples of notes could be contacted provider due to ABG results. Provider did not add any new orders. Cool, because it's shown that you made a contact to provider with a concern. That's the kind of things that I put in my nurse's notes. Radiology at bedside to do chest x-ray. I'll put that one in there. So I have time stamps of things, so it shows my timeline of care. So that's the kind of notes that I use. Am I saying Carl is the only one with the right answer on that? No, I am not. Everybody has their own opinions on it. That's just what I do. It's for things that I cannot find a place to chart in all of my areas up here. And that's true for if you use Cerner facilities or Epic facilities or Meditech. I can usually find it in these areas. So again, if I go look at respiratory, say I chart multiple respiratory assessments. Okay, I'm the chart auditor at your hospital. And I know Vincent Brody's here for respiratory problems, and we possibly had a problem with the patient. He had an oxic brain injury, let's say. I'm going to go to the respiratory tab and run a report of all the assessments on him. If I wrote a note about his respiratory assessment and the ups and downs of it, of the things I found prior to intervention and after intervention, me as the chart auditor or the investigator for a court case is going to say, Carl never charted a respiratory assessment. Or he charted one, and it was good, but he never shows that there was decline, even though he says the doctor put a chest tube in. So something isn't adding up here. So that's why on some of y'all's chart, I was saying, hey, there should be multiple respiratory assessments here. Because that was the chief complaint, and we saw ups and downs with his respiratory. So that is what I'm looking for. I hope that answers some questions. After viewing this, if you still have questions, please feel free to email me and set up an appointment with me. And I will try to make a virtual appointment with you as soon as I can and try to help you out one-on-one. So I hope this has helped you all. Like I said, if you have questions, contact me. I hope this shows you the expectations, not only from me as your instructor, but also from a chart auditor's perspective or an investigations perspective, or God forbid, if you get pulled into court perspective. Because like I said, if it's not charted, you didn't do it. Just like it showed here with the allergies. It's not there, you didn't address it. So I hope this helps. And remember, this week and next week, I'm looking at your charting and giving you my critique of it. You're not going to fail clinical because of your score this week. You're not going to fail clinical because of your score next week. As long as I'm seeing a better progression with your charting scores, since I am doing it differently than what you were expected of before, as long as I'm seeing an uphill climb on your charting, you will be fine. The thing I'll be worried about is if I'm not seeing any progression. So keep that in mind. As long as I'm seeing betterment in your charting, that is what I'm looking for. Last thing I forgot, this review tab, if you push that, it gives you the rubric that I'm using to grade. Okay. And up here, it shows you where you have done charting. As you can see, I didn't save charting in all these other places, but if you would hit the save button, it marks it. So I get the same view as you here in this and here. And what I do is I will click on like the ADLs, for instance, and it takes me to my ADLs your ADLs that you charted. See how they're in yellow? This is what was charted. That's how I go through to score your documentation. Let's see, where is it here? Here's my ADLs. This is what I'm looking for. Okay, so as long as all of this stuff here is you're seeing is hit up in here, that's how we're grading these. Okay, so I hope this is helpful. If it isn't, please reach out to me and we can sit down and talk. All right, have a good day. Be safe.